161. A nurse is caring for a patient with leukemia who is receiving chemotherapy. The patient reports feeling feverish and chills. Which of the following should the nurse do first? A. Administer antipyretic medication as prescribed. B. Obtain blood cultures and notify the healthcare provider. C. Increase the patient's fluid intake. D. Apply a cool compress to reduce the fever. Answer: B. Obtain blood cultures and notify the healthcare provider. Rationale: fever and chills in a patient receiving chemotherapy may indicate an infection. Obtaining blood cultures and notifying the healthcare provider should be done first to identify the cause of the fever and guide treatment. Antipyretics and fluid intake can be addressed later after the infection is managed. 162. A nurse is teaching a patient with lung cancer about the side effects of chemotherapy. Which of the following should the nurse emphasize to the patient to prevent skin breakdown? A. Apply moisturizing lotion to the skin regularly. B. Wear tight-fitting clothing to reduce skin irritation. C. Avoid using sunscreen when going outside. D. Take hot showers to cleanse the skin. Answer: A. Apply moisturizing lotion to the skin regularly. Rationale: chemotherapy can cause skin dryness and irritation. Regular use of moisturizing lotion helps to prevent skin breakdown. Tight-fitting clothing and hot showers should be avoided, as they can exacerbate irritation. Sunscreen should be used to protect the skin from further damage. 163. A nurse is caring for a patient with cancer who is receiving radiation therapy. The nurse should instruct the patient to avoid which of the following activities? A. Eating a balanced diet to maintain strength. B. Applying pressure to the irradiated area. C. Drinking fluids to stay hydrated. D. Performing light exercises to improve circulation. Answer: B. Applying pressure to the irradiated area. Rationale: applying pressure to the irradiated area can cause tissue damage and increase the risk of skin breakdown. While eating a balanced diet, drinking fluids, and performing light exercises are important, avoiding pressure to the irradiated area is the priority. 164. A nurse is caring for a patient receiving chemotherapy who develops a low white blood cell count. The nurse should monitor for which of the following complications? A. Infection. B. Dehydration. C. Hyperglycemia. D. Hypokalemia. Answer: A. Infection. Rationale: a low white blood cell count, neutropenia, increases the risk of infection. The nurse should monitor the patient for signs of infection, such as fever, chills, and redness or warmth at the site of an incision. Dehydration, hyperglycemia, and hypokalemia are not directly related to a low white blood cell count. 165. A nurse is caring for a patient receiving chemotherapy for breast cancer. The patient complains of hair loss. Which of the following interventions should the nurse include in the care plan? A. Reassure the patient that hair loss is temporary and will regrow after treatment. B. Encourage the patient to wear a wig or a scarf to maintain self-esteem. C. Suggest the patient avoid washing their hair to prevent further hair loss. D. Advise the patient to use a hot comb to style their hair. Answer: B. Encourage the patient to wear a wig or a scarf to maintain self-esteem. Rationale: hair loss, alopecia, is a common side effect of chemotherapy, and encouraging the patient to wear a wig or scarf can help maintain self-esteem and body image. Reassurance is important, but the primary goal is to support the patient's emotional well-being. Avoiding washing the hair or using hot styling tools are not effective in managing hair loss. 166. A nurse is caring for a patient with advanced cancer who is experiencing pain. The nurse should administer which of the following medications first? A. Acetaminophen. B. Morphine. C. Nonsteroidal anti-inflammatory drug NSAID. D. Aspirin. Answer: B. Morphine. Rationale: morphine is a potent opioid analgesic used to manage moderate to severe pain, especially in patients with advanced cancer. Acetaminophen and NSAIDs are used for mild to moderate pain, but are less effective for severe pain. Aspirin is not typically recommended for cancer pain management due to its anticoagulant properties. 167. A nurse is educating a patient with prostate cancer who is receiving androgen deprivation therapy. The nurse should instruct the patient to report which of the following symptoms? A. Increased appetite. B. Painful urination. C. Swelling of the ankles. D. Hot flashes. Answer: C. Swelling of the ankles. Rationale: swelling of the ankles may indicate fluid retention, a potential side effect of androgen deprivation therapy. Hot flashes, painful urination, and increased appetite are also side effects, but are less urgent compared to fluid retention. 168. A nurse is caring for a patient with metastatic lung cancer who is receiving palliative care. Which of the following interventions should the nurse prioritize? A. Providing curative treatment options. B. Offering emotional support to the patient and family. C. Administering chemotherapy as prescribed. D. Encouraging the patient to continue working and being active. Answer: B. Offering emotional support to the patient and family. Rationale: in palliative care, the focus is on comfort, quality of life, and emotional support for the patient and family. Curative treatments and chemotherapy are not part of palliative care. Encouraging continued work and activity is not realistic given the patient's condition. 169. A nurse is caring for a patient with cancer who is experiencing nausea and vomiting due to chemotherapy. Which of the following interventions should the nurse implement first? A. Administer an antiemetic medication as prescribed. B. Provide the patient with a bland diet. C. Offer the patient small sips of water. D. Reassure the patient that nausea is a common side effect. Answer: A. Administer an antiemetic medication as prescribed. Rationale: nausea and vomiting are common side effects of chemotherapy. Administering an antiemetic as prescribed is the first step in managing these symptoms. Providing a bland diet and offering fluids can be done after the nausea is controlled. Reassurance is helpful, but not the priority action. 170. A nurse is caring for a patient with colon cancer who is scheduled for surgery. The patient expresses concerns about the postoperative care plan. Which of the following is the most appropriate response by the nurse? A. You will need to adjust to a permanent colostomy after surgery. B. The surgery should result in complete remission and no further treatments will be needed. C. We will discuss the postoperative plan with the surgical team before your surgery. D. Your main concern should be the risk of infection after the surgery. Answer: C. We will discuss the postoperative plan with the surgical team before your surgery. Rationale: it is important to provide the patient with accurate information about the surgery and postoperative care. Discussing the plan with the surgical team ensures the patient receives comprehensive and tailored care. Telling the patient they will need a permanent colostomy or that no further treatments will be needed may not be accurate. 171. A nurse is caring for a patient receiving chemotherapy who has developed a mouth ulcer. Which of the following interventions should the nurse recommend to manage this condition? A. Use an alcohol-based mouthwash to cleanse the mouth. B. Avoid spicy or acidic foods that may irritate the ulcer. C. Brush the teeth with a hard-bristled toothbrush to remove debris. D. Apply a warm compress to the affected area. Answer: B. Avoid spicy or acidic foods that may irritate the ulcer. Rationale: mouth ulcers are a common side effect of chemotherapy. Avoiding spicy or acidic foods can help prevent irritation and promote healing. Alcohol-based mouthwashes and hard-bristled toothbrushes should be avoided, as they can further irritate the mucosa. A warm compress is not an effective treatment for mouth ulcers. 172. A nurse is caring for a patient who is receiving radiation therapy for head and neck cancer. The patient complains of difficulty swallowing and dry mouth. Which of the following interventions should the nurse prioritize? A. Provide humidification to the room. B. Administer a prescription for saliva substitutes. C. Encourage the patient to drink fluids frequently. D. Offer the patient soft foods that are easy to swallow. Answer: D. Offer the patient soft foods that are easy to swallow. Rationale: difficulty swallowing and dry mouth are common side effects of radiation therapy for head and neck cancer. Offering soft foods helps make swallowing easier and reduces discomfort. Saliva substitutes and humidification may also be helpful, but providing easy-to-swallow foods is the priority. 173. A nurse is caring for a patient receiving chemotherapy for ovarian cancer. The patient reports experiencing fatigue. Which of the following interventions should the nurse recommend to the patient? A. Increase physical activity and exercise regularly. B. Take short naps throughout the day to conserve energy. C. Engage in strenuous activity to boost energy levels. D. Avoid consuming caffeine to reduce fatigue. Answer. B. Take short naps throughout the day to conserve energy. Rationale. Fatigue is a common side effect of chemotherapy. Taking short naps helps the patient conserve energy and manage fatigue. Increasing physical activity may be helpful, but the patient should avoid strenuous activity. Caffeine can exacerbate fatigue and disrupt sleep patterns. 174. A nurse is caring for a patient with metastatic liver cancer. The patient is experiencing ascites. Which of the following is the priority nursing intervention? A. Administer diuretics as prescribed. B. Monitor the patient's weight and abdominal girth. C. Position the patient in a supine position. D. Encourage the patient to eat a low-sodium diet. Answer. B. Monitor the patient's weight and abdominal girth. Rationale. Monitoring weight and abdominal girth is essential in assessing the extent of ascites and evaluating the effectiveness of treatment. Administering diuretics and encouraging a low-sodium diet are important interventions, but should follow the monitoring of the patient's condition. The supine position is not recommended for patients with ascites due to the potential for respiratory difficulty. 175. A nurse is caring for a patient with breast cancer who is undergoing chemotherapy. The patient asks about the risk of infertility. Which of the following should the nurse explain to the patient? A. Chemotherapy is unlikely to affect fertility in women. B. Chemotherapy can cause infertility, but it may be temporary. C. Chemotherapy does not affect fertility in men or women. D. Fertility preservation options should be discussed before chemotherapy begins. Answer. D. Fertility preservation options should be discussed before chemotherapy begins. Rationale. Chemotherapy can cause infertility, and the risk may be permanent or temporary. It is important to discuss fertility preservation options with the patient before starting chemotherapy. Fertility effects can vary by individual and treatment regimen. 176. A nurse is caring for a patient with cervical cancer who is receiving radiation therapy. The patient reports feeling anxious about the treatment. Which of the following should the nurse do first? A. Offer the patient information about the radiation therapy. B. Encourage the patient to talk about their concerns. C. Provide reassurance that the therapy will be successful. D. Advise the patient to take anti-anxiety medication. Answer. B. Encourage the patient to talk about their concerns. Rationale. The nurse should first provide an opportunity for the patient to express their concerns. This allows the nurse to address any misconceptions, provide support, and reduce anxiety. Offering information about the treatment and reassurance can follow once the patient has had a chance to express their feelings. 177. A nurse is caring for a patient with cancer who is receiving chemotherapy and develops a temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. Which of the following actions should the nurse take first? A. Administer an antipyretic as prescribed. B. Notify the healthcare provider. C. Monitor the patient's blood pressure. D. Offer fluids to the patient. Answer. B. Notify the healthcare provider. Rationale. A fever in a patient receiving chemotherapy may indicate infection, which is a serious complication. The nurse should notify the healthcare provider immediately to assess the need for further interventions such as blood cultures, antibiotics, or other treatments. 178. A nurse is caring for a patient with a history of breast cancer who is receiving tamoxifen. Which of the following side effects should the nurse monitor for? A. Hot flashes. B. Diarrhea. C. Hair loss. D. Anemia. Answer. A. Hot flashes. Rationale. Tamoxifen, an anti-estrogen medication used in breast cancer treatment, can cause hot flashes as a common side effect. Diarrhea, hair loss, and anemia are not typical side effects of tamoxifen. 179. A nurse is caring for a patient who has undergone a mastectomy for breast cancer. The nurse notices that the patient's arm on the affected side is swollen. Which of the following is the most likely cause? A. Lymphedema. B. Infection. C. Hematoma. D. DVT. Answer: A. Lymphedema. Rationale: lymphedema is a common complication following a mastectomy, especially when lymph nodes are removed. It causes swelling in the arm due to the disruption of normal lymphatic drainage. Infection, hematoma, and DVT are less likely causes. 180. A nurse is caring for a patient with colon cancer who is scheduled for a colostomy. Which of the following should the nurse include in the preoperative teaching? A. Avoid drinking liquids before surgery. B. Prepare for an extended hospital stay. C. Learn how to care for the colostomy postoperatively. D. Limit intake of high-fiber foods. Answer: C. Learn how to care for the colostomy postoperatively. Rationale: it is essential to teach the patient how to care for their colostomy to promote self-care and prevent complications. The patient should not avoid drinking liquids before surgery unless instructed to do so by the surgical team. An extended hospital stay is not always required, and high-fiber foods are typically limited postoperatively, not before. 181. A nurse is caring for a patient with ovarian cancer who is receiving chemotherapy. The patient reports feeling nauseated and unable to eat. Which of the following should the nurse do first? A. Administer antiemetic medication as prescribed. B. Offer the patient small, frequent meals. C. Encourage the patient to drink clear liquids. D. Offer the patient a cold compress for nausea relief. Answer: A. Administer antiemetic medication as prescribed. Rationale: nausea and vomiting are common side effects of chemotherapy. Administering antiemetic medication is the first intervention to control these symptoms. Once nausea is controlled, offering small meals and clear liquids can help with nutrition and hydration. 182. A nurse is caring for a patient receiving chemotherapy who develops neutropenia. Which of the following interventions should the nurse implement? A. Encourage a high-protein diet. B. Maintain strict hand hygiene and infection precautions. C. Administer a blood transfusion. D. Offer fluids to promote kidney function. Answer: B. Maintain strict hand hygiene and infection precautions. Rationale: neutropenia increases the risk of infection. The nurse should maintain strict hand hygiene and infection precautions to protect the patient from potential infections. Encouraging a high-protein diet and offering fluids are important, but the priority is infection prevention. 183. A nurse is caring for a patient with a diagnosis of leukemia. The patient is receiving chemotherapy and develops mucositis. Which of the following actions should the nurse take first? A. Offer the patient soft, bland foods. B. Administer a topical analgesic for pain relief. C. Ensure the patient receives adequate oral hygiene. D. Encourage the patient to drink fluids to prevent dehydration. Answer: C. Ensure the patient receives adequate oral hygiene. Rationale: mucositis can cause oral discomfort and increase the risk of infection. Ensuring proper oral hygiene is the first step to prevent further complications. Afterward, the nurse can administer pain relief, encourage fluid intake, and offer soft foods. 184. A nurse is caring for a patient with lung cancer who is experiencing difficulty breathing. Which of the following interventions should the nurse implement first? A. Administer oxygen as prescribed. B. Provide a calm, quiet environment. C. Elevate the head of the bed. D. Encourage the patient to cough and deep breathe. Answer: A. Administer oxygen as prescribed. Rationale: difficulty breathing may indicate inadequate oxygenation. Administering oxygen should be the first priority to improve oxygen levels. The other interventions can follow once oxygenation is addressed. 185. A nurse is caring for a patient with bladder cancer who is undergoing radiation therapy. Which of the following side effects should the nurse monitor for? A. Dysuria. B. Alopecia. C. Diarrhea. D. Weight gain. Answer: A. Dysuria. Rationale: Radiation therapy to the pelvic area, such as for bladder cancer, can cause dysuria, painful urination, due to irritation of the bladder. Alopecia, diarrhea, and weight gain are less commonly associated with pelvic radiation. 186. A nurse is caring for a patient who is receiving chemotherapy for lymphoma. The nurse should monitor the patient for which of the following complications? A. Thrombocytopenia. B. Hypercalcemia. C. Hypothyroidism. D. Hemochromatosis. Answer: A. Thrombocytopenia. Rationale: chemotherapy can cause bone marrow suppression, leading to a decrease in platelet production, resulting in thrombocytopenia. Hypercalcemia, hypothyroidism, and hemochromatosis are not common complications of chemotherapy for lymphoma. 187. A nurse is caring for a patient with esophageal cancer who is receiving radiation therapy. The nurse should instruct the patient to avoid which of the following? A. Eating small, frequent meals. B. Drinking liquids through a straw. C. Eating spicy or acidic foods. D. Using a humidifier at night. Answer: C. Eating spicy or acidic foods. Rationale: radiation therapy to the esophagus can cause irritation and inflammation, and eating spicy or acidic foods may worsen these symptoms. Eating small meals and drinking liquids through a straw can help manage symptoms. Using a humidifier at night can also be beneficial. 188. A nurse is caring for a patient with leukemia who is receiving chemotherapy and develops thrombocytopenia. Which of the following interventions should the nurse prioritize? A. Encourage the patient to ambulate to prevent clots. B. Monitor the patient for signs of bleeding. C. Administer a platelet transfusion. D. Administer an anticoagulant to prevent clots. Answer: B. Monitor the patient for signs of bleeding. Rationale: thrombocytopenia increases the risk of bleeding, so the nurse should prioritize monitoring the patient for signs of bleeding, such as petechiae, bruising, or nosebleeds. Platelet transfusions and anticoagulants may be indicated, but bleeding assessment is the priority. 189. A nurse is caring for a patient with cancer who is receiving chemotherapy and reports feeling constipated. Which of the following should the nurse recommend? A. Increase dietary fiber intake. B. Use a stool softener as prescribed. C. Decrease fluid intake. D. Avoid exercise and rest in bed. Answer: B. Use a stool softener as prescribed. Rationale: constipation is a common side effect of chemotherapy. A stool softener can help alleviate constipation by softening the stool and making bowel movements easier. Increasing dietary fiber and fluid intake may also be helpful, but should be done in conjunction with stool softeners. Exercise is encouraged to promote bowel movement. 190. A nurse is caring for a patient with prostate cancer who is receiving androgen deprivation therapy. Which of the following side effects should the nurse monitor for? A. Gynecomastia. B. Edema. C. Increased appetite. D. Increased energy. Answer: A. Gynecomastia. Rationale: androgen deprivation therapy reduces male hormone levels and can lead to the development of gynecomastia, enlarged breasts. Edema, increased appetite, and increased energy are not common side effects. 191. A nurse is caring for a patient receiving chemotherapy for colorectal cancer. The patient reports experiencing mouth sores. Which of the following interventions should the nurse recommend? A. Use an alcohol-based mouthwash. B. Eat hot, spicy foods to promote healing. C. Practice good oral hygiene with a soft toothbrush. D. Avoid drinking liquids to prevent further irritation. Answer: C. Practice good oral hygiene with a soft toothbrush. Rationale: mouth sores, mucositis, are a common side effect of chemotherapy. Practicing good oral hygiene with a soft toothbrush can help prevent infection and irritation. Alcohol-based mouthwashes and spicy foods should be avoided, as they can worsen symptoms. 192. A nurse is caring for a patient with cancer who is receiving opioid pain medication. The nurse should monitor for which of the following side effects? A. Tachycardia. B. Hypotension. C. Hyperthermia. D. Respiratory depression. Answer: D. Respiratory depression. Rationale: opioid pain medications can cause respiratory depression, which is a life-threatening side effect. The nurse should monitor the patient closely for signs of respiratory depression, such as slow or shallow breathing. 193. A nurse is caring for a patient with cancer who is receiving chemotherapy and develops nausea and vomiting. Which of the following is the most appropriate intervention to prevent further nausea? A. Administer an antiemetic before chemotherapy. B. Offer the patient ginger tea. C. Encourage the patient to lie flat after meals. D. Increase the patient's fluid intake. Answer: A. Administer an antiemetic before chemotherapy. Rationale: administering an antiemetic before chemotherapy helps prevent nausea and vomiting. Offering ginger tea and increasing fluid intake can help with nausea, but are secondary to the primary intervention of antiemetic medication. 194. A nurse is caring for a patient with oral cancer who is receiving radiation therapy. The nurse should monitor for which of the following complications? A. Xerostomia. B. Hypertension. C. Polyuria. D. Weight gain. Answer: A. Xerostomia. Rationale: radiation therapy to the head and neck can cause dry mouth, xerostomia, as a side effect. Monitoring for xerostomia is crucial, as it can affect the patient's ability to eat, speak, and maintain oral health. Hypertension, polyuria, and weight gain are not common side effects of radiation therapy for oral cancer. 195. A nurse is caring for a patient receiving chemotherapy who develops alopecia. Which of the following should the nurse include in the teaching? A. Hair loss is temporary and will grow back after treatment. B. Wearing a wig or scarf can help with self-image. C. Shaving the head can prevent further hair loss. D. Hair loss will only occur in certain areas of the scalp. Answer: B. Wearing a wig or scarf can help with self-image. Rationale: hair loss is a common side effect of chemotherapy and patients often experience changes in self-image. Wearing a wig or scarf can help the patient feel more confident during treatment. While hair loss is usually temporary, patients may benefit from emotional support regarding this change. 196. A nurse is caring for a patient with pancreatic cancer who is experiencing jaundice. Which of the following should the nurse assess for? A. Dark urine. B. Increased appetite. C. Decreased thirst. D. Increased body temperature. Answer: A. Dark urine. Rationale: jaundice occurs when there is an excess of bilirubin in the bloodstream, causing the skin and eyes to appear yellow. Dark urine is a common symptom of jaundice and should be assessed. Increased appetite, decreased thirst, and fever are not typical signs of jaundice. 197. A nurse is caring for a patient who is receiving chemotherapy for non-Hodgkin lymphoma. The patient develops a fever and chills. Which of the following is the nurse's priority action? A. Administer an antipyretic medication. B. Assess the patient's vital signs. C. Notify the healthcare provider. D. Perform blood cultures. Answer: C. Notify the healthcare provider. Rationale: a fever and chills in a patient receiving chemotherapy may indicate an infection, which is a serious complication due to the patient's immunosuppressed state. The healthcare provider should be notified immediately for further assessment and possible interventions. 198. A nurse is caring for a patient who is receiving chemotherapy and has developed severe fatigue. Which of the following actions should the nurse recommend? A. Rest frequently, but engage in light physical activity. B. Limit fluid intake to avoid fatigue. C. Avoid all physical activity and remain in bed. D. Take naps longer than 4 hours daily. Answer: A. Rest frequently, but engage in light physical activity. Rationale: severe fatigue is common during chemotherapy, but light physical activity can help prevent deconditioning and improve energy levels. Rest is also important, but long periods of inactivity should be avoided. Limiting fluids or avoiding physical activity are not recommended. 199. A nurse is caring for a patient with ovarian cancer who is undergoing chemotherapy. The patient reports vaginal bleeding. Which of the following should the nurse do first? A. Administer an analgesic as prescribed. B. Notify the healthcare provider. C. Provide reassurance to the patient. D. Assess the amount and color of the bleeding. Answer: D. Assess the amount and color of the bleeding. Rationale: the first action should be to assess the amount and color of the vaginal bleeding, as this information will help guide further interventions. Notifying the healthcare provider and providing reassurance are important, but assessment comes first. 200. A nurse is caring for a patient with lung cancer who is receiving chemotherapy. The patient complains of a dry, persistent cough. Which of the following interventions should the nurse implement? A. Administer a cough suppressant. B. Encourage the patient to drink large amounts of fluids. C. Assess for signs of lung infection. D. Provide a humidifier in the patient's room. Answer: C. Assess for signs of lung infection. Rationale: a persistent cough in a patient receiving chemotherapy could indicate an infection or a side effect of treatment. The nurse should first assess for signs of infection, such as fever, increased sputum production, or chest pain. Providing fluids, a humidifier, or a cough suppressant may also be helpful depending on the findings.